Now, when a lady is diagnosed with breast cancer and meets a surgical oncologist, what are the things to be discussed? So, let me give a brief overview of what all things you should probably discuss with your doctor. Now, first, you have to ask the doctor whether the diagnosis is sure, because sometimes we have to operate on the suspicion of malignancy. The diagnosis may not be very clear. The second thing is that if the diagnosis is certain, you should reconfirm the stage of the disease with the doctor. What stage is my cancer in? And please be sure about the overall treatment plan, not just the surgery. Is chemotherapy being planned either after surgery? Is radiation being planned? All these things you need to discuss with your doctor. Now, coming to the surgery as such, you have to discuss what is the type of the surgery which has been planned for you. Now, broadly, there are two types of surgeries. One is what we call breast conservation surgery, where we preserve the breast, and the other is full removal of the breast, which is known as mastectomy. Now, you have to discuss with your surgeon which option is better suitable for you, because in certain conditions, they may not be suitable, the disease may not be suitable for breast conservation surgery, especially if it is multicentric. The second reason why you need to discuss is that when you do a breast conservation surgery, addition of radiation becomes a must. This will mean some additional cost and repeated visits to the hospital. So we have to make sure that the patient and the family members are ready for this. The next thing to be discussed with the doctor is what we plan to do for the lymph nodes. Addressing the lymph nodes in the armpit or the axilla is a part and parcel of the surgery. So you have to ask the surgeon what is being planned. Now there are different ways again here. Some surgeons prefer to go for the traditional axillary dissection where all the lymph nodes are removed, whereas some prefer to do what is known as a sentinel node biopsy, where only one node or two nodes are sampled and sent to the pathologist, and if they are positive, then the entire lymph node dissection is done. The third thing which you need to discuss with the doctor is whether any reconstructive options are planned. Now, very often, especially young ladies, if there is an indication for full breast removal, we do offer them reconstructive options. Sometimes we ask them to meet the plastic surgeon to see if the breast can be reconstructed. So broadly, these are the things that you need to discuss in terms of treatment. Then the other things which you need to discuss is that how long the stay will be there, whether any drains will be placed, what sort of sutures will have to be put, what are the complications that need to be expected. Normally, breast cancer is a very safe surgery. We don't expect too many complications, but sometimes the serum drainage or water drainage might continue for a long time. And very rarely we have other complications like blackening of the skin edges or infection and other such things. So these are broadly the things that you need to discuss with your surgeon while going in for breast cancer surgery.